All right, breathing emergencies, we're going to look at more from the perspective of um, in the front country, because it's important to note that with breathing emergencies, we want to evac people for most breathing emergencies in the backcountry. If this is some sort of slight emergency or lack of the word emergency, like someone has some inflamed asthma that they've had in the past and they know how to treat it and it seems to come down, then we can go ahead and continue on if we're able to have that communication with them. However, if we have any sort of breathing emergency that we have a fear of someone being able to move forward, being able to evac out on their own, or if symptoms don't subside quickly, then we're going to want to evac that person. So let's go ahead and look at first aid from both perspectives. So signs and symptoms of breathing emergencies, obviously no breathing would be a symptom of an emergency. Shortness of breath or trouble breathing, whether this is a known trigger or not. Unable to talk without stopping for a breath between every few words. If you live in Fresno, you have seen people having an asthma attack and you know what this looks like. Changes in breathing rate. So is the person breathing far too slow, far too fast? Are their breaths deep or shallow? And is their rhythm regular or irregular? These are the things that you want to look for. Look for those red flags. Any sort of gasping, wheezing, gurgling, or high-pitched noises, okay? Changes in skin color. If a person becomes pale or flushed, then we can allude or be alerted to the fact that this could be a lack of oxygen or a lack of getting rid of the carbon dioxide in someone's system. Dizziness and lightheadedness due to low breath count, high breath count, so on and so forth. Any sort of chest pain, we already know that as we have looked at some of those heart-related and cardio-related issues that we would want to evac them, okay? And any sort of apprehension or anxiety. So we don't really care about the cause as much as the signs and symptoms are all going to require the same amount of treatments. If a person's having trouble breathing, in the front country, you're going to summon EMS. In the back country, you're going to take a second, sit the person down, see if you can help treat them well within your means, like grab their inhaler, hand that inhaler to them, and see if that helps. If you can't, rapid evac. Okay, so get those people out. The second that someone becomes unconscious, we need to be able to breathe, right? So this isn't like the abdominal section that we just reviewed, where we have more time to see if they're getting better. Okay, if the person's finding it difficult to talk and things aren't getting better, evac them. If the person has medication, like I had talked about, an asthma inhaler, then we can go ahead and get that out of their pack and hand that to them. If they can't take it themselves, we're not allowed to actually help administer that medication. Then we're going to continue to watch people's conditions and see if it worsens or if we need to change our treatment plan. Be prepared to give CPR and an AED if you have it. Obviously, most backcountry experiences, you will not have that AED, okay? If the person becomes unresponsive, we have to start treating immediately. We talk about calling EMS, right? We've talked about the difference of the front country and the back country. If I need to call for help in the front country, I have to monitor the situation for 4 to 7 minutes until EMS arrives. In the back country, however, I need to try and keep this person breathing, and if they're not, I need to give rescue breaths, and it's my job to care for them as long as it takes for some sort of rescue to arrive, okay? Or until you become too tired to continue. So let's go ahead and watch this video on breathing emergencies.
People with asthma may have difficulty breathing when they are exposed to certain substances or conditions called triggers. Common triggers include exercise, temperature extremes, air pollution, strong odors, allergies, respiratory infections, and stress. Exposure to the trigger causes the airways to swell and become narrower, making it harder for air to move in and out of the lungs. Signs and symptoms of an asthma attack are similar to those of any other breathing emergency and include wheezing or coughing, rapid shallow breathing or trouble breathing, being unable to talk without stopping for a breath in between every few words, anxiety and fear, sweating. A person with asthma can minimize the frequency of asthma attacks by avoiding triggers and taking prescribed long-term control medications. But when an attack occurs, prompt action is needed to open the airways and restore normal breathing. The person will most likely have a prescribed quick relief or rescue medication to use in the event of an asthma attack. Encourage the person to use his or her quick relief medication as directed by his or her healthcare provider, assisting if needed and state or local regulations allow. Call 911 or the designated emergency number if the person's breathing does not improve within 5 to 15 minutes after taking the medication, or if the person becomes unresponsive. Monitor the person's condition until the person is able to breathe normally or until help arrives.
So remember, this is front country scenario, but you have that 10 to 15 minutes to decide what you would like to do moving forward in a back country scenario. If someone doesn't get better, then we want to go ahead and evac them, whether it's walking them out themselves or more likely calling help to them. So just to reiterate some of the things that the video just showed, if a person has asthma, they likely will have a quick help inhaler. This is a good habit to get into, is every time you start a backcountry trip with someone that you ask people, is anyone taking any medication? Asthma is a really common medication that people take with them in the backcountry. And then ask people, where do you keep your inhaler? And how do I know, what signs and symptoms am I looking for to know that I need to grab your rescue inhaler? Okay, I have had to do that with students in the past where I actually have to hand them their rescue inhaler and grab that for them because they're in uncomfortable situations, their pack is heavy, so on and so forth. Okay, so if a person requests the help, you can shake the inhaler, remove the mouthpiece, give the inhaler to the person and advise them how to use it. But you cannot actually provide them their rescue inhaler. It has to be given by them. They have to be able to give it to themselves. If a person's breathing does not improve in 5 to 10 minutes, call 911. We saw that in the video. However, again, that's going to be the difference is that you're going to call for help or start to evac that person.